she drew a mask on it and labeled it COVID-19 dress.
Yeah.
It's terrible.
All right, guys, let's get started.
Okay. We're ready?
Yep, let's roll.
Okay. Good afternoon, everyone. I'm Mayor Paul Elward. I'm one of the incident commanders for the Beetle County COVID-19 Task Force. Before moving into the roundtable discussions, I'd just like to take a brief update from the task force. The current update from the South Dakota Department of Health shows that we have 98 positive cases so far. Cases in Beetle County, and we have 4,250 cases statewide. Starting next week, Beetle County COVID-19 Task Force is going to be doing some testing for high-risk populations. There will be approximately 450 tests completed on high-risk populations in assisted living facilities. The tests are going to be for staff members and also for the residents. Due to the increase in the testing capacity, it's allowed Beetle County residents to be tested, and that's one of the reasons that we are seeing increased positive cases. Because of the increased contact tracing, more individuals are getting tested. It's important for individuals to keep track of where they've been and to make sure that we can track positive cases. Businesses and individuals in our community should take precautions to protect themselves at work, at social gatherings, and other times when they are out of their homes. Beetle County COVID-19 Task Force is in contact with the affected businesses, and we are ensuring that they are getting the testing that they need. With Beetle County having active cases, the Beetle County Task Force would like to remind you to be aware of your surroundings. And if you decide to travel outside of your home, remember to assess the risks and to be responsible with your decisions. We would also ask that you respect others' decisions and personal spaces. If someone doesn't want to open or to go outside, that is their right. Along those same lines, remember the 6-foot rule, social distancing. If you accidentally get too close to someone and they ask you to back up, respect that. Respect their decision and treat them with respect. COVID-19 is not going to go away anytime soon. And we have seen that this week with our new positive cases. You need to keep assessing the risk and realizing that the spread of COVID-19 is still going to happen. You have to accept the personal accountability and take steps to protect yourself and your families. Currently, there's no way to eradicate COVID-19. We can only slow the spread of the virus and make sure that we have our hospitals have enough room to handle those positive cases. We encourage you to take the responsibility to come up with a plan for your household and to take steps to make sure that it's routine and not just a sometime plan. You want to make sure that you're safe at all times. The sole responsibility to keep you and your family safe lies on your shoulders, and you must take that action. I just wanted to start off by saying that we are practicing good spacing here. We're all wearing masks, but we decided to take them off when we spoke so that it wouldn't muffle the sound. I want to start off by introducing one of our panel today. Dr. Joe Carr is our testing center coordinator and has been a great asset to the task force. Joe?
Thank you, Mayor, and your message was about what we're all going to repeat here. So at the end of this, hopefully we all understand what we can each do as citizens to help out. So I've got about 6 things I'm going to try to go through pretty quick. The first thing that I want all of the citizens of our community to remember, not only community, state, the worldwide, the number one reason we're doing all the work, whether you're volunteering, whether you're a health provider, whatever, is because we're trying to help these sick people. And we have to remember that when we get a positive test, the person on the other end of that swab is a person that is sick. So we have to pray for them, have some empathy for them. It's just not a virus we're going after. We have to really respect and care for these people. So we can't lose mind of that. Sometimes we just think we're going after a virus and that's it. Second thing I want to do, I drove down Dakota Avenue and saw the pictures of our high school graduates. And it saddens me that a lot was taken away from these kids. You know, we don't get to see them. A lot of these kids are my patients, their families, so we really miss not seeing them. I know we all enjoy what entertainment they give us, so we want to let them and their families know we're thinking about them. We certainly wish the graduates a lot of luck, and the one thing I want to tell all graduates is when you're done, when your journey is over, if you're looking for a job or a career, take a good look at Huron in our community, because we'd love to have you all come back. That's what I want to remind. And even these kids graduating from preschool, kindergarten, middle school, whatever, we wish them all luck and congratulate them. So we'll go on to the testing center. Obviously, as everybody's probably known, our testing numbers have gone up, you know, for a lot of different reasons. One of them is the criteria we're following. The hospital, we've worked out a little different criteria, and Dr. Brock is going to go over the criteria. I'm just going to tell you that our numbers have gone up. Through the week from Monday to Thursday, we did 71 tests, and 42 of those came back positive at a 59% positive rate. So that tells me a couple of things. I think we're now hitting that criteria spot on when we test them and why we test them, and also the fact that with opening it up, we're finding these positives. It also tells me that, let's say a month ago when we were testing, not quite as many, but we were all getting very frustrated that we weren't finding positives. So I would lay in bed at night and go, am I doing something wrong? So I'd read more, I'd look more, things like that. And it came to all of us that we just didn't have positives in our community at the time. Now we're, with the criteria we're using, with the testing we're doing, we're finding those positives, so that's a good thing. So we'll go over the criteria once again when Dr. Brock gets the information, so we can get down that these are the symptoms you have. Call your doctor, call the call center, do whatever, and we will get you tested. So the call center itself has been very busy. We were at a point a few weeks ago where we just had one volunteer each shift. Now we're up to 3 or 4 volunteers each shift, which is from 8 to 12 or 1 and 1 to 5. And it's pretty much, as Ted's been helping us out there, you're busy the whole time. If we could have it luck involved, about 3 weeks ago, I hit a curb on my brand new bike and I broke my collarbone and had to have surgery. So I guess we're lucky I had to have surgery because I can focus the vast majority of my time on the testing in the call center. But without our volunteers, we'd be in a significant amount of trouble. So that being said, if we keep going at the rate we are or we increase, we're going to need more volunteers. And the volunteers can be anywhere from, if you are good at talking with people or feel comfortable, being in the call center, helping us with the calls, the incoming calls, to help assess the people, get their history, get all the information, the outgoing calls to tell them when we're going to test them or if they were positive or negative, or following up in the days following if they're getting worse, getting better, things like that. Also, this morning, I spent 2 hours getting our kits ready for the testing we did at 11. So sooner or later, when I'm able to go back and start treating my own patients, we're going to need people to do that too. So there's a lot of things that you could do a 4-hour shift, you could be there all day, you could work 2 hours. There's a lot of things we could use volunteers for. So to call the chamber at 352-0000, get your name to them, tell them you're willing to volunteer, and then they can get a hold of you. That would be a great amount of help. So I kind of summed up what we do in the call center. Incoming, outcoming calls, we help manage these people, we get a hold of their providers, we do a lot of stuff. And so there's really not a downtime now. We talked about the volunteers needed. So what I want to talk about, what we've learned over the past week to week and a half on now the county getting more positive cases. We've learned that there's 5 major points that the state and the Center for Disease Control nationally wants us to really focus on, with the fact that we've opened up more of our community, opened up more of our businesses. I think we all expected we were probably going to start seeing an increase in these numbers, but the 5 points we really want to practice to continue to make it safe for our community is, number one, we want to self-monitor ourselves, all our employees. So if you're sick or if you're showing any symptoms, you have to let your employer know and just don't show up to work. When we get to work, we want to do a temperature check right away in the morning before you start work. In case it's high, then you go home. A lot of people, including Smokey here, we do it at the end of the shift too, to see where it went over that 8-10 hour shift. So self-monitor. And then we screen. For instance, in our clinic, everybody is screened coming in. Do you have any symptoms, or shortness of breath, anything? You screen them all. And we have had a lot of people say, you know what, I did wake up this morning with this or that. I had just better go home and see how it gets. So that's taking self-responsibility. Those are huge things we need to do. So self-screen, self-assess, monitor. Number 3, the biggest thing is wearing masks. Masks are going to protect you from me if I have it on. I'm Italian, I'm dynamic, I don't give people much space until now. I probably spit a lot when I talk. That keeps me from getting all those viruses all over you. Plus, it will protect you from me a bit, except your eyes. 4th thing is what Paul's already talked about, social distancing. In your work environment, at home, when you're out and about the grocery store, practice that at least 6-foot social distancing. And then number 5 was clean and disinfect your workstation, your home as often as you can. We've added a number 6, which isn't telling you to do it, but just recommending. Try to avoid any unnecessary travel. If you don't have to get in your car and go snoop around in Aberdeen or Sioux Falls, wherever, just don't do it. Just be thoughtful that the more we can contain ourselves, the better off we are. So the 5 points: screen your employees and your business people, check temps, self-monitor, social distance, clean and disinfect, wear the mask, avoid unnecessary travel for number 6, and hopefully we'll be able to get through everything and just keep this spike to a minimum here. So with that being said, I'm going to pass it along to Dr. Brock. She's going to go over, among other things, the criteria we're using now at the testing center as well.
I think my mic's on, so somebody let me know if it's not. Like Dr. Carr said, I'm going to start with talking about the testing criteria, and then I do have a couple other things from a hospital standpoint that I'd like to touch on. Right now, we are testing symptomatic people who have been symptomatic for at least 2 days with at least 2 of the following symptoms: a cough, shortness of breath or difficulty breathing, fevers, chills, what are called rigors or shakes, muscle pain, sore throat, headache, loss of taste or smell. We were previously just testing symptomatic healthcare workers, people who lived in group living situations, and hospitalized patients. So this has expanded our testing capabilities. You don't have to be in one of those 3 discrete groups anymore. If you have symptoms, you have 2 or more, they've lasted 2 or more days, you get tested. There are occasional exceptions made for asymptomatic people. I'm not going to get into that. I think that's beyond the scope of this panel today. As many of you are aware, and as my fellow panelists have already said, we have had a spike in Beadle County in COVID cases over the last week. Many of these seem to be related to travel and relaxed social distancing, and we anticipated that with some of this relaxation. I just want to reassure everybody that as a healthcare community, we are as prepared as we can be to deal with a potential surge in patients who require hospitalization for COVID and who require hospitalization for non-COVID related concerns. As I mentioned last time I was here, we are doing, like Joe said, pre-screening all of our employees as well as anybody else who's coming into the hospital, making sure that they're not having any symptoms, they don't have any known exposures, and checking everybody's temperature. We have limited visitors. We have cut back on our non-essential medical services in both the clinic and the hospital. We continue to have very frequent meetings with all of the heads of departments so that we're all on the same page in anticipation of a surge. We also have all of our COVID units set up, discrete areas that are partitioned off physically and have negative pressure capabilities in the ER on our medical floor as well as our OB floor. And if anybody's been by the hospital recently, you'll notice there's some kind of outbuildings or small buildings outside the ER, and those are ready to be used for additional traffic control and triage if they are needed with additional cases. And also have started recruiting what we call additional staff, so people who are maybe retired or part-time who are willing to come in and work additional hours or return to work if they are needed. As chief of staff, I've been getting a couple, I don't want to say repetitive in a bad way, but repetitive questions, and so I just kind of want to answer those. The first is that this week we did, as HRMC, have our first employee test positive for COVID-19. This employee tested positive yesterday, and the Department of Health is currently in the process of working on contact tracing. That person is at home on self-quarantine and is doing well. Anything beyond that, I don't think I should really comment on for protecting their privacy. We are currently at what we call at the hospital a surge level 1. That means that we currently have one person in the hospital who has either tested positive or is under investigation for symptoms. And then the other thing I've been hearing a lot about is what people perceive to be a discrepancy in the Department of Health data. I want to reassure everybody the Department of Health data is accurate. There is sometimes a considerable up to 48-hour lag when we get cases here in the community, and then those have to be reported, and then they have to be vetted and authenticated by the Department of Health. And so I've had a lot of people, I heard that there were 20 positive cases over the weekend, and that data's not, or those numbers aren't being reflected, and that's why. One of the other reasons is that the testing center, when they do test, they either come to the hospital for processing or get sent to the state lab. We also do tests internally at the hospital for people who are coming through the ER, but there are other clinics in town who are using outside labs, particularly Sanford and Avera send out labs, and so we don't always have that data immediately. Those can take a period of days depending on the physician's orders or the acuity of the test or of the patient's symptoms. Also of note is that somebody may test positive at our testing center, but their permanent address is in a different county. And so even though that person might be working here, technically living here, if their permanent address isn't in Beadle County, they're getting reported out in a different county. And that is, vice versa as well. Somebody might actually have a residence in Beadle County, but they've been tested elsewhere and aren't really living or working in the community. Other things that I just wanted to make sure that I'm addressing. One is that if you have symptoms, please call the test center if they're open. They're extremely helpful in determining what is the next best step for you. You can also contact your provider or call the hospital. There's always going to be somebody who's around to tell you what they think the next best step is for you. That being said, it's really important if you feel like you can't breathe or you are having very severe symptoms, please come to the ER. Don't let your fear of the hospital keep you away. The hospital is still the safest place for you to be in an emergency. We're seeing things, emergencies, accidents, serious illnesses, babies in my particular case still come during pandemics, and I really feel that it's important to reassure people the hospital is still the safest place for you to be for those things. So don't hesitate to come in. We are making it as safe as we can. And then just to reiterate what others have said, we need to just be smart and we need to be safe. We need to be practicing good hand hygiene. We need to be disinfecting surfaces often, maintaining social distance, not traveling when we don't need to, and masks in public. And I will say, as a personal plug, if I can stand in a hot OR and wear like a mask and a face shield and a gown, and everybody else around me can too, you can certainly wear a cloth mask when you are out running errands. It will not harm you. I know it makes you feel hot. I know it makes you feel uncomfortable, but it is really not posing any harm to you. And it is a service to your fellow community members so that if you are asymptomatic and you are not unknowingly transmitting this infection. think that's all I have to say, if Julie wants to take over.
Alrighty, thanks. I'm Julie Miller with the Department of Health, and the portion I will be talking about will be what the Department of Health staff is doing in following up on all the positive cases. So it's important, I want you to know that every positive case is being followed up on. There are instances if the positive case is deceased, that case is still investigated. They're following up with family, with friends, to still find important information that we need to continue to do with the contact tracing. If we aren't able to reach someone, we have staff that do a home visit. They wear the personal protective equipment and they'll make that home visit. So we do every attempt we can to contact every positive case. That positive case, if they are doing well and don't require hospitalization, then staff discuss with them the importance of self-isolating and how to do that safely. And in doing that, that means they also evaluate their home situation and their resources. So they find out if they have a home, they find out if there are too many people in the home to safely isolate. Then they have resources, and the staff know in every community where they're working with these cases, the resources that they have in that community to help that person to safely isolate. The important part also that takes the considerable amount of time in that case investigation is asking the case patient to identify all those close contacts. This includes household contacts, social contacts, work contacts, gathering all their birth dates, demographic information, and add language barriers to this sometimes, and this can be very complicated and take several hours for some cases. And I want to stress the importance. It is a key strategy to prevent further spread of COVID by doing the contact tracing. It is important to identify all individuals who have had exposure to that case during the time frame when they would have been most infectious. So it's so important for that case investigator to clearly explain to that client why close contacts are being asked for, and to assure them that their name is not being released to any of the contacts, and confidentiality is very important, and we stress that to all of the contacts. Now, a close contact is now defined as being within 6 feet of a COVID-19 case, and for at least 15 minutes is what they're saying now. So a close contact can occur like if you're caring for someone with COVID, living with someone with COVID, visiting someone with COVID, sharing a waiting room with a COVID-19 case. Department of Health staff will notify any identified close contacts of their exposure. Every close contact is evaluated to see if they have symptoms, and further recommendations are provided to limit their contact with others for at least 14 days. Now, if they have symptoms, they are considered a person under investigation, and they are referred on for further medical evaluation. If they have no symptoms, they are contacted and instructed to isolate at home and to take their temperature twice a day, watch for their symptoms, the fever, the cough, the shortness of breath for 14 days after their last exposure with that positive case. And contacts are to report any symptoms or temperatures of 100.4 or higher to the Department of Health by phone. Now, each of these people, they get their telephone number and they set them up for the text illness monitoring. So they will be enrolled to receive a daily text message, and this message asks them every day if they have developed a fever, if they have a cough, shortness of breath, and instructs them that they should respond daily to that text message for the duration of their monitoring period. So those messages will automatically continue for 14 days from the time they are enrolled in that system. So that's an important step, is following up with all of those case contacts. So again, I want to reiterate the importance of social distancing, frequent hand washing, and wearing a mask, and continuing to keep 6 feet between yourself and others. The face cover is not considered a substitute for social distancing. Just because you wear a face mask, you still need to maintain your 6 feet. So that's what I have to share for today, and I will pass it on to Ted.
Thank you. I am Ted Hayter with the Greater Huron Development Corporation with a few items about businesses and programs available in the Huron area. Greater Huron is working on a set of guidelines similar to what Dr. Carr talked about, and to be honest, we would thank the Yankton Area Chamber and Development Corporation for their assistance on this one. They have put a playbook together that identifies best practices for business, and not just business in general, but specific businesses like retail, restaurants, daycares, whatever it might be. And we hope to have that rolled out and ready to go within a week. Another item we have available for area businesses is the Forward Huron Loan Program. And that's a simple application online submitted by email. $2,000, $4,000, or $6,000 loans with no interest or no payments for 2 years to Huron area businesses who are in need of a bit of capital to help them get through this process. We've made about 25 loans so far, and it's ranged anywhere from restaurants to small retail businesses to in-home daycares. So if you need money or know of a business that needs money, please go to greaterhuron.com, and the application for the Forward Huron Loan Program is there. We're trying to keep as many other resources and as much data up to date and available as we can on that website. Again, it's greaterhuron.com, and there's a COVID-19 tab at the top of the page where we keep track of those resources, the data, and we try to refresh all of the daily cases that the state kicks out for Beetle County and the Huron area as often as we can. One more time, greaterhuron.com for those resources, for the Forward Huron Loan Program, and look for that playbook for businesses recommending the 6 key points and other things that you can do to keep yourself, your employees, and your customers safe. Thank you.
Say, Ted, before we have Smokey talk, I want to add one thing that you guys worked on, specifically the chamber. So when we first started working with the task force, we knew if my whole family is quarantined, isolated, and no one's capable of bringing food or essential needs to your house, we've arranged a lot of different entities to help out there. At the call center, we have all the numbers. When the people come for testing, we give them a sheet that has it, but I'll just give you, I might forget some, but obviously the grocery stores of Coburn's and Fair City and Walmart, if you just call there and let them know either you need something delivered or if you can't afford it or whatever, they'll start working with you. The Salvation Army, especially if you can't afford it. There's the food pantry, the school district. I believe all those entities are set up to help people, most importantly with their essential needs and their food. So if you need those resources, I don't know if it's on your website, but it certainly is at the call center, or just call those businesses. Now we're ready for Mark Houston, right? Okay, Mark, you're up.
Some people call me Smokey, some people, my real name's Mark Houston. I'm the HR director at Dakota Provisions. I thought maybe I would start this discussion with why Dakota Provisions feels that we were successful in keeping coronavirus out of our facilities until last week. First and foremost is the guidelines that was set down by Huron by the City Council and local coronavirus committee. They've taken a wonderful common sense approach for all of us that live in Huron. Second, at our facilities, we began following the same guidelines months ago. We also started having several employees sanitizing all high-traffic areas such as doorknobs, vending machines, bathrooms, other areas such as sinks, tables, every 15 minutes throughout the day. With residents following the same stay-at-home, wash your hands, wear a mask, practice social distancing guidelines, most everyone and every business in Huron was quite successful in keeping this virus out of Huron. What happened? I'm not sure everybody knows exactly what happened. One couple chose to ignore these guidelines and travel to Aberdeen on Mother's Day weekend and visit relatives. One of these relatives worked at the beef plant in Aberdeen. When this couple returned to Huron, they learned that one of the people they had visited had now tested positive for coronavirus. That mistake took us to where we are today. Our employees are very important to us. Without employees, we cannot process food. Our employees have been very loyal in coming to work through this whole process. As of this morning, Huron has amassed a total of 98 positive cases. Of those 98 cases, only 9 of those people work at Dakota Provisions. When employees enter and exit our facilities, they are monitored to make sure they sanitize their hands and their temperature is checked. If an employee shows any temperature at all or other virus-related symptoms, they are directed to return home, call the hotline, and we pay them to stay home. All our employees are required to wear masks at work. Several of our employees wear a paper mask, a cloth mask, and a face shield, all at the same time. At the beginning of the pandemic, we made both the corporate office and plants off limits to visitors and vendors. Also, several months ago, many of the colonies donated 5,400 cloth masks to Dakota Provisions for employees to wear, and we still supply those masks free of charge to clinics, the hospital, and businesses in Huron. In addition to these cloth masks, at that time we also purchased over 34,800 surgical masks. Meetings at both the corporate office and plants are now held on the phone instead of in person. As I stated before, employees are required to stay home if they're sick, and they are paid for that absence. Employees that are quarantined due to positive exposures are also paid to stay home. We also have several employees that are working from home. We have several other employees that have requested to take a leave of absence away from work for a period of time until they feel the pandemic has ended. All new employees that started Dakota Provisions from outside the city are quarantined before 2 weeks before they can begin work. Last month, we built a pavilion outside on the east plant so employees could practice better social distancing during break periods. We've also installed plexiglass barriers at all locations to separate employees that are eating lunch. Each and every day we make physical and work rule changes to safeguard our employees. But to be effective, it gets back to the same general rule. Wash and sanitize your hands, stay home, don't leave Huron, practice social distancing, stay home from work if you're sick, and monitor your temperature. Each person is responsible for your own safety. If you want to take risks by not wearing a mask, washing your hands, or going out of town, you are the one that may suffer those consequences. Please remember that this is Memorial Day weekend. Try to stay home unless absolutely impossible, and let's all stay safe. Mayor?
Thank you, Smokey. We also asked a representative from Jack Links to be here today. They have a plant down in Alpena, and there's been some positive cases there too. They were not able to attend today, but they did send an approved statement, so I'd like to read it to you. We confirm that team members at our facility in Alpena have tested positive for COVID-19, and we are following our strict protocols that with respect to those positive tests. Our protocols were developed in accordance with the guidance from the CDC and USDA. Our top priorities are the well-being and safety of our team members, the food safety of our products, and excellent service to our customers. The CDC says that there's no evidence that COVID-19 can be spread through food, and we are confident that all food coming out of our facility is safe. We are continuing to closely monitor the situation, check in with our team members who have been impacted, and share updates with our team members as we receive them. So we'd like to thank Jack Links for sending a message here today, and I'd like to thank all of our panel members for this community update and trying to keep everyone informed as best we can. We have a couple of questions I know here that we would take now, or whatever we have in to.
So the first question is, can the city enforce businesses like Runnings, Walmart, grocery stores, and Lewis to only allow one person per household to shop?
The city will not enforce one person per household. We have not put that in our guidelines. However, we have set guidelines that limit the amount of people that should be in a business. And we would, by complaint, we will look at those instances where maybe a business is not complying. And they are enforceable by our ordinances. However, we are not here to fine people. We are here to help people stay safe, and that's what we will continue to do.
We have one more question. I think this is for Julie. How are people counted that test positive but have no symptoms? Do they count towards our new cases? And then are they also counted as recovered that same day?
Ooh, that's a tough question. Whether you're symptomatic or asymptomatic, a positive case is a positive case. So you're counted as positive. Sometimes it can be, depending on when you had symptoms and when you were tested. Some people have, by the time they have been talked to, it is time for them to be out of isolation. So they can be recovered at the same time that they are investigated.
Okay, no other questions for today. Again, thanks all the panel people today. Just a reminder, it is a weekend, a holiday weekend. Stay home if you can, but be safe. Thanks, everybody.
Paul, let me add one thing. We plan at the testing facility, we're gonna have a staff at the call center on Monday, and then over the weekend, we'll divvy up the phones, so one of us will have a phone. So that will be available, and we're planning on testing at 10 in the morning on Sunday. You obviously have to get set up for that, but we wanna make sure everybody knows that through the long weekend, Sunday, we will be testing, so if you're sick now, don't wait till Monday. And then Kim's showing me the number. Our call center number is 353-6214. So if you're having symptoms now, either get hold of your healthcare provider, call the call center, and we'll start working with you. Thank you.
Thanks, everybody. I think that's all we have for today.